Hello everyone, my name is Dr. David Landsberg. I'm the Medical Director of the Kidney Transplant Program at St. Paul's Hospital. On behalf of my colleagues at the Vancouver General Hospital and the BC Transplant Society, I'm pleased to present this video to you today. In this video, we're going to tell you a little bit about the referral process for transplantation, some of the things you will expect during your workup for a kidney transplant, and then tell you about what to expect after you receive a kidney transplant. In this presentation, we're going to give you an overview of your eligibility, the criteria that we use to assess people for a kidney transplant, some of the aspects about living donation, some of the aspects which are different about deceased donor transplants, the option of living donor paired exchange, the surgery itself, and then the follow-up you're going to receive after your kidney transplant. You're going to be cared for by our transplant team. Our team is composed of a significant number of members. We have the transplant nephrologists, the medical doctors who look after you with respect to your anti-rejection medications and monitoring for rejection, looking after your overall medical situation, the transplant surgeons, the social workers, the transplant nurses who care for you in the pre-transplant program as well as in the post-transplant program, the pharmacist, the dietitian, our research coordinators, and our clerical support workers. Kidney transplants have many benefits. For many people with kidney failure, a kidney transplant is your best treatment option. Especially in younger people, it's going to improve life expectancy over dialysis. It's important, however, to remember that a kidney transplant is still a treatment. It's not a cure. You're still going to have to take long-term anti-rejection medication. You're still going to have to come for regular transplant checkups. But the quality of life you live is going to be better than the quality of life that you're going to have on dialysis. So when you're thinking about a kidney transplant as a treatment option, you want to know what are the benefits, what are the risks? Is it worth it for me to take the risks in order to get the benefits? So with respect to risks, there's obviously the risk of the surgery itself, but then there's also the long-term risk of being on anti-rejection medications and some of the things that these medications might do to your immune system and hence leave you susceptible to things like infection or even an increased risk of cancer. Who's eligible for a kidney transplant? In order to have a kidney transplant, you have to be in reasonable physical health. We're not looking for perfection, but somebody has to have a reasonable life expectancy, otherwise maybe it's not the best thing to do. You need some family support, some ability to get some help from your family when you need it. You need to commit yourself to long-term anti-rejection medication and some of the post-transplant follow-up, which we're going to need you to do with respect to regular checkups. Kidney transplant is the best treatment for most people, but some people just aren't the right candidates. Some of the reasons why you might not be eligible for a kidney transplant would be if you had cancer, if you had a severe infection, if you had a severe psychiatric illness, which meant that you wouldn't be able to look after yourself, you wouldn't be able to take the anti-rejection drugs. If you were addicted to alcohol, addicted to other drugs, then your number one priority would be taking the drugs or getting a drink rather than looking after yourself, and so a transplant would not be appropriate in that situation. If you have a very serious medical condition which is going to limit your life expectancy, then a transplant might not be the best treatment. But age on its own isn't a reason why you shouldn't have a transplant. We look at each individual, look at the benefits, look at the risks, and decide whether it's worth it for you.
Hi, I'm Leah, and I'm a recipient nurse at St. Paul's Hospital in the pre-kidney transplant program. The journey of your transplant starts with being referred through an online system by your home team or by your kidney specialist or primary nephrologist to one of the 3 transplant centers. Candidates who are referred to the transplant programs must have good social and family supports, be willing to have a transplant, and also have a long-term commitment to a medical regime. As part of the transplant referral, baseline testing is required. Baseline testing is done by your primary nephrologist or your home team. Once all the baseline testing is completed, medical consults and investigations are then forwarded to the transplant center. Once the referral has been submitted online to the transplant program, A transplant recipient nurse will then call you to let you know that we received your referral and let you know and answer any questions you have about the transplant process. We then also send you a package which includes the following information. Following your transplant referral being sent to the transplant team in Vancouver, a transplant evaluation or assessment is required by the transplant team to see if you are medically suitable for transplant. You then come down to Vancouver and meet the following specialists: a transplant nephrologist, the transplant surgeon, a recipient nurse, and a transplant social worker. Following your transplant assessment and meeting with the transplant team, medical consultations and investigations are required. Sometimes these investigations and medical consultations can take up to 2 months or longer. However, your transplant team here in Vancouver, as well as your home team, will keep you informed every step of the way.
After you've had your visit down to Vancouver, the transplant team has assessed you, and we've discussed you at our team rounds, we're going to evaluate all your testing and then tell you whether you're approved for a kidney transplant or not. We'll make a decision as to whether it's best for you to go on to a deceased donor transplant, go on to the waiting list, or whether you can get a living donor transplant. There are many reasons why a living donor transplant is preferable to a deceased donor transplant. First of all, it's elective. It allows us to plan. We can do it when we want to do it, when you're able to do it, when you're ready to do it, when the medical situation is the best. It allows us to do what we refer to as a preemptive transplant. That's a transplant before you need to go on to dialysis. Because you can only go on the waiting list after you've started dialysis, preemptive transplant can only be offered to people who have living donors. Preemptive transplants give the best medical results. People who have had a transplant before they go on to dialysis do better, live longer than people who have been on dialysis for a period of time. Living donor transplants in general do better than deceased donor transplants. Patients on the waiting list do well, but not quite as well as people who get living donor transplants. So because of the ability to time it, the ability to get a preemptive transplant, because of the better results, living donor transplants are our #1 treatment, our preferred way to go.
Hello, my name is Shelley. I'm one of the transplant social workers in the province. A frequently asked question is who can become my donor? Often, family members, friends, work colleagues, or acquaintances will step forward for testing. One can also obtain a living donor through the non-directed or living anonymous donor program. One of the difficult tasks in pursuing a living donor transplant is who will I ask to be my living donor? Your transplant team and your home team can help you navigate this difficult question. Your transplant team or your home team will be able to sit down with you and have a long discussion about how to approach a donor and the benefits of receiving a living donor transplant.
Let's talk about matching. In order to receive a transplant, you have to be compatible with your donor. First of all, we need blood group compatibility. We don't need the blood groups to be the same, but they need to be compatible. So somebody who's blood group AB is in the very fortunate situation of being able to receive any blood group donor's kidney. So an AB can receive an A, an O, a B, or an AB. On the other hand, if you're blood group O, then you need to get a blood group O donor. If you're blood group A, then you can get an A or an O. If you're B, you can get a B or an O. So O's only can get O's, ABs can get anybody's. In addition to blood group matching, we also look at the compatibility with respect to tissue typing. So tissue typing looks at how genetically people are similar or dissimilar. Obviously, the closer your genetic match, perhaps the better the outcome. Now, there are some people who get living donor transplants who have a very well-matched living donor. Those give us the best outcomes. Perhaps the most important thing, though, is to make sure that there are no antibodies in your blood, in the blood of a recipient, against the donor. If there are antibodies there, despite all the other compatibilities, these antibodies will immediately go into the donor's kidney and cause rejection. So the most important test that we're looking at is the cross-match test. This is looking for antibodies in your blood against your donor. And if the cross-match test is positive, that means we can't go ahead and do the transplant. If you're blood group compatible with your living donor and you have a negative cross-match against your living donor, then you may receive your transplant directly from your living donor. If you're not blood group compatible, or if you have a positive cross-match, you may still enter the living donor paired exchange program with your donor, hoping to receive a match in that exchange program. It's important for you to realize as a recipient that we have a separate team looking after the living donor. For us, the most important thing is that for the donor, it's voluntary. The donor has to be able to feel comfortable with the process and therefore work at their own speed. The workup, therefore, may take a short period of time, but it might be quite prolonged. And because of our desire to protect our donors, you may not know a lot about what's going on other than to say the process is underway. We are very careful to make sure that the donors have 2 perfectly normal, healthy kidneys, that they're otherwise in good health, and we feel that after donation, they're not going to be at increased risk.
If someone's interested in becoming a living donor, they can contact the following programs at St. Paul's Hospital, Vancouver General Hospital, or for more information at the BC Transplant website. For patients who don't have an identified living donor and have started dialysis, are then added to the provincial waitlist once they've been approved for transplant. The waitlist in BC consists of 3 of the transplant programs: St. Paul's Hospital, Vancouver General Hospital, and BC Children's Hospital. In kidney allocation, it's first done by categorizing patients into their blood type, either being blood type A, B, AB, or O. Secondly, we then rank patients by their dialysis start dates. This is not the date at which they were evaluated or approved for transplant. Thirdly, we also look at the patient's age being similar to the donor's age as well. Also in kidney allocation, there are exceptions or priorities at which need to be looked at, such as medical priorities, including patients who aren't able to dialyze, children under the ages of 18 years old, patients who are able to receive a combined kidney pancreas transplant, as well as finally those who have high antibody levels. Furthermore, in kidney allocation is age matching. First of all, if a donor is found to be less than 35 years old, it's first allocated to children, then to adults less than 55 years old. If a donor kidney is 36 years old to 59 years old, it is first assigned to the waitlist guidelines with no preference to the recipient's age. Lastly, if a donor kidney is age 60 or older, it is first assigned to adults 60 and plus. While waiting on the waiting list, waiting times for each blood group can vary. Therefore, your home team, as well as the transplant team, must review you on an ongoing basis to ensure that you are kept healthy and ready for transplant at any time. Waiting on the wait list, you must contact the transplant team or inform your home team if any of the following has occurred to you. If you received a blood transfusion, have an active infection, any changes in your health or hospital admissions, if you plan to travel outside of BC, and if your contact information has changed.
I'm Dr. William Gourlay. I'm the Surgical Director of Renal Transplantation at St. Paul's Hospital. When the times come for surgery, it might be an anxious time, but the success rate is very high and the outcomes are expected to be good. When we do call a patient in for surgery, we have up to 24 hours between the kidney removal in the donor and the actual transplant operation itself. It's not an uncommon operation. We do up to 3 a week here in Vancouver between our 2 hospitals, Vancouver General and St. Paul's. So you're not going to meet an anesthetist or a nurse or anybody from the surgical team that isn't quite familiar with transplant recipients. Once we're underway, the surgery is not long. It takes about 3 hours. And the recovery period is also not that long. By the end of 5 days in hospital, you should be walking around fairly easily, on a regular diet, and have learned your medications, more or less be ready for discharge. The surgery shown here reveals that we leave both the kidneys in, the native kidneys in, and the transplant kidney is placed in the lower abdomen. I'm often asked about whether we remove the native kidneys, but there's no real benefit to it, so we typically leave them in place. I don't need it for space. The transplant kidney sits quite comfortably in the lower abdomen. It's also well protected from the day-to-day knocks and bumps that it might experience. It sits beneath both the skin and the abdominal muscles, so there's no real concern with injuring the kidney playing sports, say. Complications from the surgery are not common. For example, blood loss is usually negligible, and the need for a blood transfusion is very rare. If there is one surgical complication that we sometimes see, it's where we connect the transplant ureter to the bladder. And about 1 in 20 or 5% of patients will develop some scar tissue where the reimplantation of the ureter takes place and may need some other procedures to dilate or open up that scarred ureter. Other than that, the success rate of the surgery is very high. At the time of the surgery, we might actually put a transplant stent in the ureter to help with the healing of ureter to bladder. The stent's done in many cases, so it's a matter of routine. If we do place a stent, it'll have to be removed via cystoscopy about 6 to 8 weeks down the road. If the kidney comes from a living donor, then it's expected the kidney will work immediately and that no further dialysis will be necessary after surgery. If the kidney comes from a deceased donor, then it is possible the kidney will have some delayed function. That is, the surgery will go well, but the kidney doesn't function immediately, in which case some dialysis might be needed after surgery. If there is some delayed function to the kidney, that will get better with time. Typically a number of days before the kidney starts to work. On rare occasions, it may be a couple of weeks. The recovery period after surgery is up to 6 weeks, where patients have to be careful about how much activity they undertake. There'll be no lifting heavy objects or exercise until about 6 weeks go by. After 6 weeks, the abdominal wall and the incision should be fully healed, and I'd encourage you to go back to your regular activities.
Usually after your kidney transplant, you're going to feel pretty good and you're going to be able to get out of the hospital pretty quickly. Our average length of stay is only 4 or 5 days. However, all of the action is at the beginning. That's when rejection is the most common. That's when we need to be making frequent dosage adjustments of your medications. Therefore, we're going to have to see you frequently. That means for people who live out of town, they're going to have to relocate to Vancouver for a little while. We ask people to plan on staying in Vancouver at least 6 weeks, and the average is about 10 weeks after your transplant in order to have that careful follow-up. For those of you who live out of town, you'll be able to work with our social workers to arrange for some accommodations. The Kidney Foundation has suites available. Maybe some of you will have friends and relatives that you can stay with. When we talked about the risks of kidney transplant, we mentioned the anti-rejection drugs. You need to take these anti-rejection drugs for the rest of your life. These drugs allow you to have a successful transplant, but they do have some potential side effects, and some of them are serious. There's an increased risk of infection. There's a small but real increased risk of cancer. And for some people who are susceptible to diabetes anyway, it can unmask the diabetes. This isn't to scare you or talk you out of it. There are many more risks of not having a transplant, of staying on dialysis, but the drugs are powerful and they do have some significant side effects. Although you've had to take anti-rejection medications, you're taking these medications for the benefit of a transplant. And transplants have significant benefits. Patients with transplants live longer, they feel better, they're healthier, they have a better quality of life, they enjoy their lives more, and overall it's a better treatment for you. We've covered a lot of ground. A transplant is a treatment. It's the best treatment for chronic kidney disease, but it's not a cure. You will have to take long-term anti-rejection medications for the rest of your life, and we've talked about the side effects of those medications. On the other hand, the quality of your life, the longevity of your life, and the way you will live your life will be significantly better after transplant than if you're staying with dialysis. In order to get onto the transplant waiting list or get approved for a living donor transplant, you're going to have to go through a lot of tests. We're going to have to repeat some of the tests some of the time, and it may be frustrating, but hopefully in the end it's going to be worth it to you. So for those of you who are going to receive a living donor transplant, remember that the donor workup may take some time, and your donors are going to have a lot of tests. After your transplant, we want you to live a good life. We want you to live a healthy life. We want you to live a full life. And most of the shoulds and should nots are just common sense. It's very important that if you have questions, if you have concerns, instead of not being sure, maintain contact with the transplant clinic. We're here to answer your questions. We understand that this is a challenging process, it's a complicated process, and sometimes it's very stressful. If you have questions, the transplant coordinators and the whole transplant team are available to answer your questions. Thank you, everyone.